Hi everybody, I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne, on scars, and pigmentation. I do a lot also with facial balancing. I'm going to walk you through this case. It's a patient after a single combination acne scar. This was 3 months after a really amazing, impressive collagen response. She's a patient in her mid to late 20s. And you can see for this patient, really significant improvement already after that combination session. So I'll go through just how we could get to this for some patients, especially when we control their acne, control their oil production. We really can get robust collagen responses. And what's also nice is that you can see overall the skin quality itself, the skin tone itself has improved as well after we did that. So even though we had to go a little bit strong for some patients, and a lot of times we do want to make sure that we can optimize results, we can still do it in a very safe way over and over again. It's just a matter a lot of times of controlling external factors like sun exposure, like cigarette smoking, alcohol use, diet. All those type of factors are really critical to make sure that we can cut that kind of collagen response started. And this result actually gets better and better over time, which is awesome. So this is where it's at right now, but it's going to get even better, which is really cool. Because it's like one of those things that just, if you're happy at this point, you're going to be really happy as the scars continue to improve, that collagen continues to get remodeled. You got new skin over here. It's going to be awesome, actually. So really fun. It's like one of those things you could see this process of the journey at this point already really good. So imagine where it's going to be really soon. So someone who's asking, Unknown is saying, how effective is filler on acne scars after subcision? So I don't normally do it all. Sometimes I do it the same day, but usually what I do is the subcision part. And then for some areas, I may do a little bit of volume like Bellafill, for example, or Sculptra, but I don't do like all the amount of filler that I need to do the same day that we do subcision usually, because I want to make sure it's the exact proper location that we're going to place it in. And some areas, okay, like the lateral cheeks, sure, we could do it that way. But, a lot of times I want to be really careful with certain anatomy, certain areas, like the lower part of the face. I'm going to say I'm not going to do that filler in that spot right there. So it depends, but yes, filler is really important. This patient required filler as well. We did it actually for her that same day with a little bit of Bellafill in her case. The Bellafill actually went down over the course of 3 months. So that's going to get even better. That skin quality will get a little bit better there. It's more just like there's 20% that's going to stay in certain spots there, but there's more of this collagen response that's going to occur over the course of the next 3 to 6 months now from here. What is the treatment done for this patient? So we did excision for this patient. We also did TCA cross. We did CO2 laser as well. So we did a few different things actually to get to this result over here. So a few steps, and then plus we did do a little bit of Bellafill for a patient. And through the laser channels, we also placed a little bit of dilute Sculptra for her to stimulate more of that collagen response as well. Let's see here. I know I'm missing a few questions, so I'll try to circle back with some people here. Let's see here. Patty saying, is there a way to solicit your services for a plan? Because I don't live in your state, but I like your results. Yeah, I'd be happy to go through. You can schedule a consultation. I could go through it really in terms of what I would recommend for your skin. So I'll be happy to help you with that. Let's see. Period is saying, finish Accure treatment. When can I start using my other washes and creams? It depends. Did we do our follow-up yet? I'm not sure. Usually I wait for the active ingredients, but if you're a few weeks out after your last session, otherwise it's under control, you could start using like a mild retinol or like a low dose of a retinoid. Just try to see if you can schedule an appointment with me and I can take a look and see what's going on there. Tenkat is saying, what can you do for ice pick scars? So TCA cross and excisions, like this patient required a bit of an excision here. And that's typically the best option. But if there's like some thick edges around the scar, then really lasers help a lot. So that's actually going to be helpful as well for patients. Let's see here. Mrs. Jones, appreciate you. Mrs. Jones saying, hello, Dr. Qazi, beautiful result. Appreciate you. And thanks for always coming on too, by the way. I'm up is saying, what's up, Dr. Qazi? Unfortunately, I'm not going to be able to see you this week. Was looking forward to it. Look forward to seeing you whenever you're ready. I'm up. I think I heard what happened there, so I look forward to seeing you soon when everything gets taken care of for you. Shakti is saying, sir, there is 100% results for deep acne scars. Are there 100% results for deep acne scars? No. Don't focus on 100%. We're trying to get it so that this is less visible. We want it so that you feel more comfortable and confident with your skin. Don't obsess about the percentages. Don't obsess in trying to get glass skin, 100% skin, 100% improvement. You're never going to be happy in life. Try to focus on something else that you could control a little bit better, because this is not going to be that. Yeah, and maybe you're not going to be able to control anything in life if you're trying to shoot for that, really. Try to get it so that it's going to be better, something that's going to be making patients, or yourself more comfortable, confident in your skin. That's the thing that we're going to try to achieve, and that's what we can achieve every time. But 100%, no, we're not going to be able to get to that. Tanya is saying, with surgical scars, stitches from younger years that look like ice pick scars, do you do similar treatments? Yeah, absolutely, we could, and I'll be happy to help you out with that, though, no problem. So yes, we could help with that. Surgical scars, absolutely. How far apart are these pictures? This is 3 months out, actually, for this patient. Smiley saying, Doctor, do you see patients in Dubai? I have a lot of patients in Dubai, a lot of requests to go over there. At this time, nothing that's set. So what does the treatment do to the patient in the photo? So we did TCA cross, we did excision, we did CO2 laser as well for this patient, and erbium laser for this patient, as well as some Bellofull for her. So we did a few different steps. This is 3 months out for this particular patient. So a few different things. Rihanna saying that they're in Tampa, Florida. So that's no problem. I have a lot of patients in Florida. I'll be happy to help you. It's something I pride myself on, taking care of patients. Most of our patients come from out of state. Probably 60-something% of our patients come from out of state. My patient today flew in from Toronto. So really, people from all over and all over the world, all over like overseas as well. And the reason why is because I really try to maximize the improvement in each session that you come in. And I'm like obsessed with that. I really, really want to make sure that you can get a beautiful result each time. Kimmy, this was actually for this particular patient. This was a single session for this particular patient here. So this was a single session result at this point. So really robust collagen response, and this is a patient, a Hispanic female, really excellent results already. Katie Parker is saying, can you do all these treatments in one visit? Yeah, this particular patient, we did do it all in a single visit. It just depends on the location. Sometimes if there's areas like below the cheekbone, for example, I don't want to put volume in there at that point. But other areas, yes, we could do that even at that single time. Let's see here. Where was I at? Can retinol help fade pitted acne scars? A little bit. It's not going to help much, though, for pitted scars. It could stimulate a little bit of collagen. Mostly what it's good for is it could reduce the diameter of some of the scars because it reduces the oil production. So that's where it helps out, actually. How can I get rid of acne redness? Well, there's a few different issues, really. It depends on how soon you're talking about. If it's just immediately after, a lot of times just with moisturizing sunblock, it really will just go away. But a lot of times you could start with like a low dose of azelaic acid. Just 10% azelaic acid is over the counter. Start with that. If you need to escalate it, go see a physician for that. And you could go up to like 15, 20% if you need to. Or you may do a laser like XLV is what I use. Other people use VBeam. Other people use DermaV. All good options. It depends on your skin type. I like XLV because it's just got a small footprint. It's very cold. But there's other devices out there that I haven't played around with, and I'm hearing a lot of people say good things about it as well. So I'm happy with whatever you do as long as it's safe for yourself. Does omega-3 help with acne? It helps with, there's not necessarily if it's going to help with acne per se, but it will help with hydrating the skin, which is really important because as your skin gets a little bit dry, what ends up happening is you really kind of produce a little bit more oil production. The sebaceous gland gets a little bit hyperactive, and then that could trap some bacteria on the surface of your skin. So that's, one of the reasons why it's recommended. Zinc is also helpful, especially after we do the scar treatments. I like doing it because it helps just wound healing. So zinc is something else I recommend. So I do omega-3s and zinc after we do the scar treatments for a lot of patients, especially more severe scars. I'll really recommend it because it's going to help you actually with the recovery and the wound healing. Good seeing you, Angie. Appreciate you coming on. Actually, thank you. Haven't seen you in a while. What kind of skin treatment for intimate areas if you have heavy scarring? Sometimes it's not about laser in that area. You may want to do something more with like Bellathil, for example, in small little spots if you need to, or something like Sculptra, for example. But you may not necessarily want to do as much of like aggressive lasers in that area because just the amount of downtime, recovery, you're not going to be able to, particularly have like sexual activity for a couple of weeks. Sometimes if you're using like lasers, so being mindful of that, we just want to make sure that if we're doing this, we're going to be like the recovery process also should be a little bit smoother and easier for you. Mardo is saying, do you accept patients from Texas? Yeah, I would say really 60 or something % of our patients are out of state. And I would say that actually the vast majority of our out of state patients come from Texas. So really a lot of patients from Texas, a lot. Very, it's awesome. Can you open a clinic in Dubai? Now you're the third person on here to ask that. It's something interesting. I'll take a look and see at some point. I'm really busy over here, but I hear you. I have a lot of people that have asked me a lot of messages about that too. We'll take a look and see what's going on. If you guys message all the people that are interested for me to be in Dubai, that'll be interesting because I could kind of game plan a little bit there to see what's going on there. Unfit saying, any way to remove scars like that without laser treatment? Okay, so any way of doing this without laser treatment? Good question. Okay, so that's a good question. Let me see if I could try to zoom in on this original photo here. Here we go. I'm going to make this really, really big for you. Let's see here. Okay, so if you look really, really close, look at the scars and you can see that there's this thickness around the scars. People would look at that and say this is acne. It's actually not acne. Those are actually just tiny little hypertrophic scars around the scar tissue. And you can see there's like this thickness overall of the around the scars. And that's what I refer to with, I'm talking about the thickness around scars. And one thing I'm like a stickler for is reducing that. So I literally could sometimes, it could take me a little bit of time because the next patient I may have to wait a little bit, or I should say they may have to wait a little bit because I'm going after a lot of times each of those individual thick areas. And I just keep on smoothing it down, Now, there's other cases you may see where it's like a little bit more severe, where it's really thick around there, and that's where I'm going to go and really work on smoothing it down. And there's some patients where it's not too bad, but that's where the laser helps. It helps with all those thick elements right there. So if you look at that, you can see that texture, that thickness, that's where the laser really, really helps actually. So that's why a lot of people say, can this laser work? Can this laser work? Yeah, sure, it could work. All those kind of lasers could help stimulate collagen. But I'm doing more than just using the lasers for collagen. The thing is that in darker skin types, I don't want to use too much heat, too much energy, because what could end up happening is you could get post-inflammatory hyperpigmentation or you could lose pigmentation. So instead, I use the laser at pinpoint areas where it's like thick around the edges, for example, or areas where I'm trying to soften up a little bit of those edges a bit more and try to close the diameter of the scar. That's what I'm actually doing with the laser a lot of times. Sure, am I trying to stimulate collagen? Yes, but I'm doing other tools. I'm using other things to stimulate collagen, not like depending on a laser for that, because it could be catastrophic. Most of my patients are darker skin type. More than 85% of my patients are darker skin type, Fitzpatrick 4 and above. And it's really, really difficult to treat that skin type with any modality, but especially doing just lasers and energy devices like that. You really run into a lot of problems. You're going to cause catastrophic pigmentation issues, and instead using multiple combination approach is actually really key for that demographic. Speaking of, here's Zio Maro's on one of the platforms over here. Appreciate you coming on, and look forward to helping you out soon. Mardo saying, I have a deep acne scar on my right cheek. What treatment would you recommend? It depends. I mean, if it's one single scar, I had a patient today. I don't know if she's going to let me share, but she comes all the way from Sacramento. It'll be really cool. She's second step we did, and it is so flat, so smooth right now. It's a wide boxcar scar. And it was a location, it was perpendicular, so you couldn't really just excise that scar and just really, hope for the best, because what will end up happening is that it will cause too much tension as it's healing. So if you just took out like that kind of wide boxcar scar, it'll cause too much tension, which could actually get wider. And I see that over and over again. Actually, for some of those people that were saying from Texas, there's a couple people in Texas that keep on doing these excisions and people they shouldn't be doing it on, and it gets wide for them, and it takes a lot of work now to fix that. So yes, I could absolutely target like those individual scars. It just depends on what's happening, what kind of skin type you have. If we could just excise it, sure, we'll excise it. Let's see here. GMT is saying, do you accept patients from GMT is asking about patients from Texas. Yes, we absolutely could. How old is this patient? This patient is in her mid-20s or so mid-20s. Let's see here. I'm up and saying I'm getting breakouts during the time for the last few weeks. I'm not 100% sure what is causing it, and it could leave a new scar. Any topicals that can promote healing, or do I just wait? Yeah, you could do oral antibiotics or topical antibiotics. You could also do, in the meantime, you could do silicone tape. Actually helps as well. It helps with the inflammation, helps reducing that inflammation. So really strongly consider silicone tape. I think it's awesome that more people, like this patient, was ended up using silicone tape too. Just more people should use silicone tape. It's really, really helpful for scars, especially like when there's an active lesion like that. Really consider it. It's going to help out. Hormonal acne help. So, if you're a woman, it looks like it because it says she's nice. I would recommend something like spironolactone. Spironolactone is really great for pretty much anybody that's any woman with acne-prone skin. And then you also could start something like an oral contraception like Yaz. So consider that, but definitely spironolactone, excellent option there. What do you think of microneedling for scars? This patient tried it, didn't work, didn't help enough. She's helped a little bit, mildly, but didn't get to where it needed to be. This is what got it there. This is ultimately what got there. Does at-home microneedling help? Not so much for scars. It's not going to help too much for that. Maybe a little bit for like anti-aging purposes, but not so much for scars. What do you suggest to do for a PIE if VBeam didn't work well? Well, it's possible that because of your skin type, they didn't want to go too harsh, too much energy. So I'm not sure what your skin type is. You may need more sessions of VBeam or another laser like XLV. Either any of those things could be the reason why, the best thing for you. It's tough to say though, because I don't know what your skin type was or what the layer, what level of the laser they used. But sometimes it's just because it's like you need more sessions. It's not because of just one session. What does VBeam do? VBeam helps with little red marks that sometimes occur after acne, post-inflammatory erythema, or sometimes for rosacea patients as well. All good options for that. Helps out with that. I use XLV because there's less bruising, less downtime, less chance of post-inflammatory hyperpigmentation, darker skin types, at least from what I've experienced. So that's why I usually use XLV, but a lot of people use VBeam. It's pretty ubiquitous. And I always say it's a lot safer for certain skin types, especially Fits 1 through 3. You could consider it for Fits 4, but you just have to be really careful. Go to someone who really knows what they're doing for that. And I've done actually XLV on even patients Fitzpatrick 6. Actually, there's ways to do it. It's just and it works actually really, really well. What method do you do to smooth down the scars? I use the ablative form of CO2 laser. I do it like a pinpoint areas. And I'll just keep on tracing different scars if I need to. Do you have any advice for spironolactone causing irregular cycles other than lower dose or birth control? That unfortunately would likely be unfortunately that could be a side effect for spironolactone. A lot of patients would report though that that's something that does go away after the first 3 months or so. So kind of one thing is just to pay attention to is that it may actually just go away. But unfortunately, you may end up needing to be on either a lower dose or birth control. I know that's not what you wanted to hear, but you may end up needing to be on that. Ernest is saying, do all these treatments work as well for a mid-40s male? Yes, these absolutely could work no matter what age you are. It's okay, really. We could do this at any age group. It's just sometimes you may not get as fast of a collagen response. Sometimes, we're going to really try to make sure that there's other factors that are under control. You're not getting UV exposure, things like that. But yes, we absolutely could still do that though. Let's see here. Yucky saying, I have big pores. Is Accutane something I should consider asking about? If you want to, it's possible you could do low dose microdosing of Accutane for pores, but there's better options. Just a topical retinoid could be all you need to do. Accutane's pretty much overkill really for just pores by themselves. Moonlit Bay is saying, for lasers, do you have a specific aftercare regimen you recommend? Yeah, I keep it really simple. I mostly treat it as burns, so I use a burn protocol really. Sometimes I use a burn recovery mask or other ways of just really just keeping moisture locked in there, allowing you to heal safely so that there's less chance of infection. Infection is actually super critically important after a burn. You really want to make sure that that's under control for the first, really while the wound is healing. Really, really critical. So those type of things actually factor in a lot more than any of these kind of topical creams, stuff like that people push. There's some people that would try to push like vitamin C serums right after these ablative CO2 lasers, things like that. I think it's, I don't know if anybody's ever, I don't know if the people pushing it have ever tried it on their, so it's funny. A long time ago, they were telling me to do this, like vitamin C all the time, vitamin C. And I watched someone, she was paid by one of these vitamin C companies. And at the time I was really naive and I just trusted her because it was like, oh, she's always like, seems like she's honest and true. And I didn't realize she was paid by these guys. And she says to do it after CO2 laser. So I don't do things on patients. I was like going to try it myself. So I did it myself and it stung, it really burned. So I was like, I don't think anybody who recommends doing this after lasers has ever done this before, because it's like, that was just like, I don't know what they were talking about there. It was terrible advice. So some of this stuff is like, and like this botanical stuff and things like that seems really unnecessary, really like it really could cause an inflammatory reaction as well. And the last thing we want to do with scar healing is these kind of inflammatory reactions. With acne-prone skins, we don't want that. So, I keep it very, very simple. I just treat it as a burn. A lot of my background is with burns, so I did a lot with burns. And it's like, I got to be really careful with patients. That's how I treat it. And that's how we can get through, I think, in patients of darker skin type than anywhere else, really, because I treat it like that. I don't treat like with random stuff and random products in people's faces. And I don't have you guys just get like a bunch of skincare regimen after me, where it's the stuff that I use. I'm using Vanity Cream. I'm using physical sunblock. And like the physical sunblock is like, I'm like, okay, go use Neutrogena's physical sunblock. Use whatever physical sunblock you want to use. It's just, those are things that I pay attention to. I use sometimes like a silver cream as well, so to help with antimicrobial, to help with making sure bacteria doesn't flourish on there. So little things like that, like the things that I typically do. And then at some point I'll introduce some silicone tape as well. And that's really the main thrust of it. Diet does play a role though. Like I was saying, zinc does play a role in wound healing. So pay attention to that. Sun exposure, really, really important to minimize that as well. Yeah, it was painful, but vitamin C after, so imagine they're pushing vitamin C afterwards and they're like saying that this is going to be the key for laser results. And the vitamin C serum costs, I think, like $165, $180, something like that. Maya saying, will I lose my cheek fat or volume when you treat my acne scars? And well, actually, a lot of times the scars destroyed fat, they destroyed some skin, and then destroyed some fat. So a lot of times, actually, just from having scars, you actually had lost some fat. So no, what we're doing is not going to try to actually remove fat. What we're doing is we're working a certain layer just to break up some of the scar tissue. I did a whole talk on this last week on Thursday, and I was going through subcision. And you can see just the layers that I'm talking about, how to do it safely and effectively. And in terms of, the laxity sometimes that occurs with scarring, what happens is that because the scar is pinning down an area of your face, sometimes as you're smiling, you're stretching out the skin around it. And that could cause more laxity there. And that loose skin basically requires sometimes energy devices to tighten, or even surgeries really to improve. So, or sometimes what I use is like something like dilute radius, which stimulates elastin production to tighten the skin a bit more. So that helps as well. Also, how do you feel about beef tallow for your skincare instead of dermatologic products? I believe in natural remedies instead. Well, vitamin A is natural, so there you go. By the way, I learned how to pronounce tallow. I say tallow because I'm from Chicago and like our A's are different, but everywhere was like saying like, why do you say it that way? It's because my A's are different, guys. I'm from Chicago. But yeah, so I'm trying to say the way that like the rest of America says tallow. Can benzoyl peroxide and azelaic acid go together in skincare? And okay, so interesting enough, actually I was going to post it today. I saw a study now well, we know about the benzene study. That was interesting, actually, right? That the benzene is linked to carcinogens. And now it turns out that they're pulling benzoyl peroxide off of the market. They're pulling some benzoyl peroxide creams. Let's see which one it was. L'Oreal is doing a voluntary recall of benzoyl peroxide. Interesting, right? L'Oreal is doing a voluntary recall of benzoyl peroxide. And because of that benzene concern, I've always been saying things about benzene. Actually, I could pull up that article here. It's interesting, right? It's an interesting situation that that we see. I'll link it in my stories actually, but it's interesting. Look at this. This is from in Dermatology Times. I don't know. I'll pull it up there. But it's L'Oreal issues voluntary recall of benzoyl peroxide over benzene concerns. So interesting, right? So that's why I haven't been pushing it. I never liked it. I thought it was way too drying. I think it's okay for spot treatments. It's okay for that, of course. But it's like the way people pushed it for so long. It's like this cure for everything. I think it's problematic for too long term. I think sulfur-based medications are better. Like things like just even sulfur washes are great, excellent. You're not going to run into problems with that. But benzenes, I think we're seeing there's some issues with it. And I think you should pay attention to a lot of that. I think we're learning a lot about that now. Angie's saying alternatives to CO2 laser, kind of microneedling, exosome, subcision, Redness, Sculptra, and thank you from Colombia. So alternatives to CO2 laser. So it depends. You may not necessarily need CO2 laser. It's not that you have to have CO2 laser. Sometimes like today's two of my patients I did today, I just did erbium lasers only. Some patients would do just TCA cross and a little bit of Belafon. Actually, the patient that flew in from Toronto, I didn't do laser on her. I only did TCA cross, Belafil on her. So, it's not that I have to do laser and I insist on doing only laser. But if it's the right patient, the right type of scars, then yes, laser is really helpful for you. Puffy nipples, is that in reference to gynecomastia? Puffy nipples is saying, my dream is to get treated by you someday. I appreciate you, Puffy Nipples. Thank you. And hopefully you're taking care of that gynecomastia, if that's the case. I'm assuming that's what you mean by puffy nipples. Moonlit Bay is saying, thank you for the info and answering questions. Would you recommend doing laser for hyperpigmentation before doing laser for acne scars? I would do it afterwards. Almost always do it afterwards. Typically I treat the scars, then we do the things for hyperpigmentation later on. How's it going, Carolina? Good seeing you on, by the way. Ashu saying, I'm from India. I need my acne treated from you. What to do? You could schedule a consultation. Just do a virtual consultation. We'll be able to help you out actually with a virtual consultation. What's a good benzoyl peroxide replacement? So Dapsone works incredibly well. Consider doing Dapsone. Use a sulfur-based face wash. That helps a lot. So consider that. I'm okay with a little bit of spot treatment from benzoyl peroxide. It's just that, I think we have to pay attention. There's a cancer link to it. L'Oreal just withdrew their products right now. Just happened today. I was going to put that in my stories, actually. Interesting, right? It's an interesting type of situation here that L'Oreal just did this. They pulled off their benzoyl peroxides from the market. And, initially they were saying, well, there's not enough evidence. But I always say that the absence of evidence doesn't mean that it's not true. Sometimes it's like, especially when it comes to like cancers and, potential risk of things like this, it's like really difficult to say what caused a cancer. I don't know what caused a cancer a lot of times because it's like there's so many different factors. There's so many different reasons why somebody may have had a cancer. And if this is something that you're adding into it, and there's alternatives, like I said, sulfur-based medications, maybe consider that, like maybe do something along those lines. Tenny saying, thank you so much, Dr. Qazi. I'm Fitzpatrick too. I'm pale. Tried both purpuric and non-purpuric for the VBeam. Do you think XLV is a good next step? It's possible. It's tough to say. I mean, your Fitzpatrick 2 really should have been a little bit stronger and you said you were purpuric. So it really should have improved it, but I'm not sure how many sessions you needed. Maybe you needed more sessions, and it's possible that another alternative laser could be a better option. Maybe if it like pinpoint spots, which XLV could do really well with that too. Mike is saying, I went to your site to book a consultation, and there's a $50 coupon that doesn't work for it. That coupon goes towards treatments, not towards consultation. Consultations are just at that price. Where am I reading the messages from? I actually can't name all the different social media platforms, but we'll just say that it's a tube one and then also the IG one. So I do different ones there. So They don't. They said that they give you like a warning if you like talk about other platforms on here, which is kind of odd because sometimes I want to say go look at that video over there, and it's like you gotta like stop yourself. The censorship and stuff is crazy. There's so many different forms of censorship. Like that's actually just a censorship right there. By the way, the fact that I can't just say what platform I'm on, and the fact that these guys don't even talk to each other, and I can't just like have it so you guys get to see the entire chat. Like one day I want to do that. We're going to see all the chats on one thing. And that's the way it should be. It should be like if people want to be on one platform, they could be on that. If people want to be on another platform, they could be on that. So yeah, that's where you're seeing all the questions actually. So it's not just on here. I have other platforms that I'm talking to, and there's some people, especially international patients, that don't have access to certain apps, and so that's why I like to use it for that. Let's see here. What is your fee for a virtual consultation? It's $150 for a virtual consultation there. Do you have to do the laser on the whole face for atrophic scars, or can you just target the problem areas? I leave it up to you, really. As long as I'm okay. For this patient, for example, we worked on the areas with the scars, then we blended it in the cheeks. I did do elsewhere because she requested it, but it's up to you. I do pretty much the full face except for the under eye area. And, if there's no scarring elsewhere, I'll let you know, like there's no scarring. If you want me to do it, I could do it for you. But a lot of patients say, sure, do it just for anti-aging purposes. Some other patients say, it's okay. I don't want to deal with that recovery right now. It's okay. Don't worry about it. Especially like, younger patients don't really worry about certain areas. It's like, no problem. But some older patients, they may want me to go do the forehead area, things like that, wrinkles area, no problem. And they have no scars there. That's okay. So I cover all that. Really at that time, sometimes it just depends on what you want to do. Price ranges for ice pick scars. Tough to say. I don't know how many scars you have, but most patients spend about $5,000 to $7,000 on their scars. So on average. Hello, doctor. What about results from PRP microneedling in old acne scars? So yeah, I don't really ever show that because I don't believe in it. I tried it many, many times. Never found it to be too effective. I only found it effective when I was doing it with subcision, but it was because of subcision, so that's the reason. It was because of subcision. And it was like, once I realized that the PRP wasn't improving the scars too much too, it was like helping. I do think it helps with the healing though. But it wasn't like something I was going to be able to say to patients confidently and comfortably that, hey, this is going to improve your scars as well. It helps with your healing, and I'll say it's going to help with your healing, but like I said, I can't like comfortably say that to somebody that PRP is going to solve your scars, improve your scars, and that's why I don't push it. Someone was asking about exosomes. That's why I don't push exosomes. I can't comfortably and confidently tell you that exosomes are going to improve scars. I haven't heard from anybody else really that I trust that says that exosomes help with scars. Why should I add that kind of cost on somebody? It just doesn't make sense. So the stuff that I'm doing, I do it myself, and it works incredibly well. And it's like, I actually did a test, was it 3 months ago or so? I did a laser, and I did do one of the exosome products afterwards. I don't know if it made much of a difference. It stung a bit. It did help a little bit though, maybe like for healing, maybe. But I'm going to do like a split face test next time. I'm going to do like one side with exosomes and one side without it, and then I'll let you know, and we'll take a look at it. Hello, doctor. Do you really feel satisfied with the Accure? Do you think it is a good replacement for Accutane? Well, it depends on what kind of acne it is. Moderate to severe acne, oil production. Yes, it helps incredibly well. It really is now hand in hand. We have enough data really to showcase to patients that really it is really very, very similar to to patients who were on Accutane as well. I was on Accutane 3 times. It's not like, sometimes you do still have oil production, but there's no question that each time it was significantly reduced. And really, I think all patients that would say that they've done a cure, they do find 70 to 80% reduction of their oil production, which is awesome. So here and there, you may still have some breakouts, and then you just have to do some topical antibiotics for a little bit to just wipe that out, or like a sulfur-based medication like Dapsone, for example. So yes, it works incredibly well. Very high satisfaction for sure. And it's just a matter, though, that's I think why they limited it to who they give it to, the Accure. They don't send it out to like every practice, because some people just weren't too comfortable with managing acne. And there's a lot involved. I'm assuming you being a physician, and I think you said that you were in Kazakhstan, right? So I'm sure you're comfortable enough with acne, and you'll be able to handle just like the bacterial component of acne, just like you would for Accutane. Nawaz is saying, does subcision cause droopy skin, especially when done on the cheeks? Can it make the area sag? So I went through this whole thing last week. You could look at it. There's a whole video of me talking about that. But I do believe if certain areas, yes, it's possible to cause sagging if it's done with the wrong tools, with the wrong amount of force, really also the wrong plane, and sometimes also with other filler products as well combined with it. I think that's really important to really pay attention to. There are some patients that I've actually they've come to me after they've gone elsewhere, and they've actually showed me, it's really clear, that there is really proper sagging in the lower part of the face. I see it very, very obviously that there's proper sagging. There's a couple people that do it, and it's almost always those people that have done that cause that issue. Really, I haven't seen it from a single other person at this point. But it's unfortunate. So it's clearly a technique issue. A lot of times it's the tool to the area that they're doing it in. There's sort of like this arrogance with the way people do it sometimes too. And you'll see it's like they don't act as if it's like, a patient that they care about enough, or it's like something that's it could cause a catastrophe. And it's like, these are young patients you're dealing with. We want to make sure that you're going to age perfectly. You're going to age amazingly. I want it's easy for us to get amazing results just like in a week or so, but I want this to last 10, 20, 30, 40 years. You're looking at your skin, you're really happy, and you just never even remember all the trauma you went through. That's the goal of this thing. The last thing I want to do is cause more trauma. So that's why I hyper focus on making sure it's super safe. Each individual band we're breaking up really safely. And that's how we could do it. And I did it today really exceptionally well at each of those spots. Just broke up that, localized the area, broke it up, and localized another spot, broke it up. And that's how you could do it really safely. So is it possible? Yes, but there's ways to do it safely. And there's very, very, very few people that I would trust to do it. Really, let me just put it that way. So it's definitely something that I think more people need to know how to do it safely. And at some point, it's just everybody needs to talk about that. I do hope that. I hope that everybody knows how to watch, how to do it, and see if you can't do it this way, don't touch it. Don't touch patients. It's like the last thing you want to do is cause more. You guys went through a lot of trauma with your acne, with your scars. So the last thing I want to ever do is cause more trauma, more anxiety for patients. It's the last thing in the world. So we would just 100% want to work on this. I would love your opinion on Benev exosomes. So Monarch Laser Guy is saying, I would love your opinion on Benev exosomes. So are they topical? Is that what it is? Is this topical, right? Ganesh is saying, I have 3-year-old scars. Sir, can I get better results? Treating scars early gives better results. It doesn't matter about the age. Can we get a bit of a robust collagen response immediately? Sometimes there's less tethering. Yes, but we still could ultimately get that better result though, ultimately. I know I have a few more questions, so I'll try to hit those. I'm a little bit over time, so I'll just hit a few more things here for you guys. Is there a machine that can be used or anything for liposuction scars or even BBL scars? Sometimes the best thing to do is a little bit of filler, like a little bit of Bellafill or Radiesse, Sculptra, all good options there. How can we book for you? You could book directly on my page, drqazi.com. We do a lot of our patients are out of state, so we're happy to do virtual consultations, help you out, walk you through how I treat your scars, and just feel free to. All of our prices are on there as well. Just go to drqazi.com. You can see that there. And I'll answer one or two more questions here. Let's see here. SB is saying, in most of your videos, TC and laser are done in the same times. If not done weeks apart, are the effects the same? It depends. If there's thickness around the edge of the scar, I really try to do the laser the same day. It helps a lot so that we can really stimulate collagen production, really smooth down the edges of those scars really nicely then. So that's the reason why. I have a chickenpox scar on the nose bridge. Is it treatable? Really, really tough spot. Probably the best thing to do for that is a little bit of laser and some filler there. Probably the best option. Maybe a little bit of collagen stimulating products, potentially if somebody is really good with it and they know what they're doing. And someone's asking if I could please answer the questions. I don't know. Winter, you just have to repeat your question. I don't know. There's so many questions and it looks like it was way, way, way behind now. So if you want, I'll wait for you to repeat your question and I will get to that now. So the last question will be Winter's question. If he wants to ask again, I don't know if he jumped off. Nawaz is saying, I had subcision on my cheeks and noticed droopiness since. Can it be reversed? consult with me. We could take a look. I had a patient a few weeks ago. She was on here actually a little while ago, where I had to do a little bit. She had done subcision elsewhere with that one of those doctors I was talking about who has been causing subcision, has been causing droopiness after subcision. And what I ended up doing is doing a little bit more subcision, and that did help provide the patient with a fuller smile, fixed quite a bit of that issue actually for her. So it's possible that sometimes you have to fix some of the tethering elsewhere, and maybe that'll improve some of it. But it depends on how significant that droopiness is, what exactly is happening there. Okay, so Winter's saying scar on the nose. I actually answered that, Winter. You missed it. Saying that you could do a little bit of laser and you could do some filler right there. That's typically the best option there. All right, guys, appreciate